Hello, my name is Chelsea Victoria, and I will be talking about leading access, youth in healthcare advocacy. So, in many communities, access to quality healthcare remains a challenge. But across Africa, young leaders are stepping up. So, this is a story of how leadership, initiative, and advocacy are making a difference. I'll be talking about the purpose of the documentary, the connection between theory and practice, and the importance of youth leadership in healthcare. So the theoretical learnings I got is that in the professional skills lab, I learned that leadership involves communication. And one of them is um, active listening, stakeholder mapping, knowing the people that you are solving the issue for, the interpersonal and group communication, the media communication that is creating content for the sources of the problem I'm working on, problem solving, and collaboration. And these are just a few of what I learned. So, in my experiential insights, I interned at SFH, which is Society for Family Health in Rwanda. I also helped in writing an article in malaria control and prevention, whereby I documented and planned what I will put in the article and what the company has been doing in the aspect of malaria and combating it. Overview about this article is that malaria remains a very big public health challenge in Rwanda, and the districts that are affected are Kayonza, Chirere, Nyagatare, and Bugesera. And the communication barriers that are in this place is limited awareness about preventive measures, inconsistent community engagement, gaps in the messaging, and inadequate follow-up. So the article is called National Strategic Plan and National Results Best Financing Malaria Social and Behavioral Change Communication. And SFH Rwanda is driving a data-led community-powered solution in malaria prevention and control while advancing in the public health practice and research. So the skills I learned and gained. My journey has shaped my personal branding, which is I'm passionate about accessible healthcare. So the skills were in communication for public health impacts, strategic content development for awareness, real-world insight into social and behavioral change, and teamwork and organizational skills. Initiative or the final reflection is that I didn't wait to be told what to do. I took initiative, reorganized workflows, supported clients, and led communication efforts. So these moments taught me how to lead with purpose. I also took pictures and content in the health post I went to visit in Bugesera, and it was a good experience. So leadership in action is that I mobilized a peer assessment and worked with the community health workers in the session that we took. We got 4 representatives that will reach out to the community about the services and services that are provided in the health post in the community. I also was part of the communication department, whereby I drafted a script for what would be needed. The career opportunities that I would want to do as working in an NGO, especially Society for Family Health, which is the World Health Organization part. I do want to look into policy think tanks and digital health startups like telemedicine and health apps. So effective communication is very crucial, especially in the malaria prevention. But internship is helping bridge the gap between strategy and community voice. So the ongoing efforts are very sustainable. So I'm grateful to have contributed to a cause that saves lives. And the future goal is to champion equity in African healthcare systems. So this is just the beginning. As a future health leader, I am committed to making care accessible, one voice, one action at a time.